modern animal protection, the legislator and the society request all involved parties to always look for equivalent replacements for the animal model. How must one imagine this consideration process?
First and foremost, all parties involved must identify the necessary requirements. The initiator of an animal experimentation project is always obliged to clearly formulate understandable goals for the intended training or the evaluation of a new medical device. Several models and possible uses are then assigned to those goals. In the consideration required by law, we always attach great importance to the fact that in addition to animal models, other models are also considered from the outset. That can be technical models, animal organs, or human cadavers. We then analyze and evaluate all those model possibilities several times. Naturally, everyone involved is part of that process. The test planner, the test leader, its deputy, and of course the animal welfare officer. Even those physicians play a role here, which later on participate in the training or the evaluation of a new medical device.
What do you want to achieve with a model that is used instead of an actual patient?
Quite important for the success of the respective training and evaluation hoped for by all parties involved is not only the model in replacement for the patient as such, but also the way it is used, which ultimately determines any measurable effect later on. Does it only serve for the purpose of illustration, or is it used in application? And if so, how intensively are diagnosis and therapy related to a particular clinical situation being applied on it? In what capacity is the model used? Just for an individual or for a whole group of medical professionals? Does the planned realistic application of medical technology also fit the abilities of the model? And if so, what direct benefit is derived from using it? In other words, a wealth of questions which we always carefully consider. The simulation of a typical procedure in everyday medical life is therefore indeed a very complex process in which we combine all known model-based possibilities with the experience of the involved parties. This labor-intensive process of weighing up the options ultimately results in a training or trial plan. In this plan, we also formulate a hypothesis, so we make assumptions that we subsequently check.
What happens if one of the planned models is not clearly superior to all other options? If the results of the weighing process even favors the use of several models?
Yes, that is not unusual, as we experience that rather frequently when we analyze the strengths and weaknesses of individual model options in a systematic and unbiased manner. If that is the case, we end up with an evaluation or training plan where each planned use of a model is assigned to specific goals. In such a way, several partial results contribute to the final outcome of the project. When learning and training of complex procedures, for instance, happens, one often proceeds in steps. Each of the particular exercise modules has its own learning objectives, and the participants get trained on several complementary models before finally checking their expertise either as individuals or in a whole team within the whole entire procedure.
How do you repeatedly manage to develop safe and promising simulation plans for so many different occasions?
This is primarily thanks to the people involved and their lifelong experience for sure. Their diligence, perseverance, but also the common desire to plan and carry out each experiment in the best possible way makes the necessary teamwork successful in the end. In addition to the perspective of those people who develop the evaluation or training protocols, we have been systematically collecting feedback from participants over 15 years. We always ask them, please evaluate the model and its effect on you as a physician. The wealth of answers, now several thousands, is indeed the most valuable information for us when it comes to the question, is the use of the animal model still justified, or are there better alternatives to achieve our goals?
You often speak of an ethical dilemma that underlies many animal experiments. Can you please explain this?
So, the animal experiment for a project in healthcare is always related to an ethical and legal dilemma. For instance, the young, still unexperienced physician should not and must not learn and gain practical experience exclusively in everyday medical practice. Because learning also means allowing mistakes to happen in order to learn from them. Mistakes that do not belong in a responsible treatment of patients. So, in contrast, the animal experiment as part of a continuous medical education program offers participants a unique opportunity to practice and discuss difficult situations and possible risks with experienced colleagues in order to be well prepared for routine and emergency afterwards. The novel, not yet extensively tested medical device is not yet part of the routine treatment of patients. All parties involved, patients, relatives, physicians, industry, and we as a society have developed comprehensive rules, both ethical and legal, to protect patients from such unnecessary risks. For both cases, professionally simulated substitute situations are needed, situations in which no patient can be harmed, so we use the animal model alone or in combination with other models instead of a patient requiring treatment. The training or innovation laboratory replaces the model workplace in the hospital. Ultimately, everyone is happy and grateful when we succeed in professionally simulating these situations, when we make protected rooms available for the people working in them, and when the time invested by those involved ultimately brings the desired learning or testing success.
If the consideration process ends with a clear vote for one of the animal models and you withdraw from alternative ideas, how do you proceed?
Look, the possibility of animal experimentation often arises from two aspects. It begins with the organism of the animal model, which we usually encounter as a healthy animal, but sometimes also in sick condition. This starting information, which is quite important for every project, is determined in the best possible way at the beginning and completed afterwards with modern diagnostics during the whole length of the experiments. Thus, we do indeed find animals that already match certain disease conditions of patients. In addition, there's a profound knowledge in the literature of how deficiencies and associated diseases can be induced. We always look for the best possible match between the goals of the project and the characteristics of one or more animal models. An invasive ventilation therapy is given to those who already experience significant limitations in normal breathing due to age or certain diseases. If we succeed in influencing the condition of the lung in such a way that the invasive ventilation therapy becomes obligatory, then the model naturally offers best working conditions for all those projects which have to do with invasive ventilation or their secondary diseases.
What is the second aspect?
The second aspect is the balance of properties in terms of use. A sick lung is successfully treated when usually three things happen. First, before and during ventilation therapy, the attending physician should examine the conditions of the lung and the supply of oxygen to the body and vital organs in order to further optimize the therapy. Laboratory examinations, images of the lung from X-ray or computed tomography can be generated, of course, from animals at any time in the same quality as when treating actual patients. Second, the therapy with a medical device involved and the necessary medication should be selected and implemented in such a way that it is of course appropriate for the cause of the disease. This can also be absolutely realized when using animals. No necessary treatment on the animal model has to be carried out in a critical haste or in deficiency. Third, the intensive care workplace for monitoring and ventilation, the pathologically altered animal model should meet all technical, personal and organizational requirements of a modern intensive care unit. Our training and innovation laboratories do fulfill those requirements in almost all aspects. In other words, it's of minor importance for the simulation of the treatment of a lung-diseased patient, which requires artificial ventilation, whether the anatomical models of the animal models are identical to humans, as long as the functional conditions are very similar. In this case, the anesthetized animal model with induced sickness is not only sufficient, it is very often the best available simulation model. In all non-living models, we would be completely out of place in this case, because the functional conditions are considerably different, since the diagnosis and the therapy of a diseased lung requires a living, autonomous organism.